Health is offering a new, convenient, safe alternative for healthcare. Health nurse practitioner Becky Liebert is the guest on this edition of Health Check 360 to introduce us to the new Health video visit. Welcome.
Hi,
so good
you.
to have you with us,
evening.
Becky.
Hi, Becky. How are you?
I'm doing well, thank
you.
you.
know, I've done this telehealth thing, okay? So the viewers should really pay attention because this is a lot of fun to do.
And Nick, you got it nailed. It's easy
if
for
I
our
can
viewers.
do it, you
Anybody
can do it.
right?
Absolutely.
Right.
And but it's just a great new thing that came out of the coronavirus thing. So tell us about what is it all involved. Tell them.
Okay. So the video visits are a way for healthcare providers to meet with patients, but meet with them virtually. So we ask questions face to face, just like we are meeting right now. You're doing it over a smartphone, over a tablet, over a computer, anywhere where you have an internet connection and a camera to be able to do this. And we talk to the person, and we're talking just like this.
Right.
And people say, well, how do you do this on a visit? I can't do this. We've done demonstrations with people and show them, like, you can bring your camera right to your eye and show an eye infection or show something by your eye, or you can show by your mouth to show what a sore throat would look like, and do you have tonsillitis or not. So there's a lot of things that you can get from the video to actually mimic what we would be doing in real life with a patient.
And the healthcare provider can ask those questions like, well, show me your rash.
Exactly,
and,
exactly.
Or, well, where exactly in your head does it hurt?
Right.
Yeah, that kind of thing. Very good. And for those, I think all of our viewers would know what virtual means, but now we've had experience with Zoom and other things, so people should know that it's just talking to each other on the TV.
Right. But what's a little different from this compared to some of the sites like Zoom or FaceTime or Messenger or Skype, which a lot of people have used, Health was really concerned about maintaining people's privacy. So we wanted to have a HIPAA-compliant venue that would be able to work with patients so they could feel that it was confidential, safe, secure, and that somebody wasn't streaming in and listening to what they had to say if they were discussing something private.
Very good point for viewers. They should know this isn't something that's just going to get spread out all over the place.
Right.
Okay, very
You know,
good.
the federal government had a waiver and allowed everything to happen for 90 days, and we wanted to create a product that worked when the 90 days were done. And that was the right product that we were going to put for our patients.
Okay.
Becky, if one of your patients doesn't even know how to start to use, where would they go just to figure out how to get into the virtual?
To our website.
To your website.
Right.
So get that's what they that's the biggest thing that they need to know is get on the website and get into the.
I have an answer.
No,
I have an answer to that. I have an answer.
Okay.
Well, no, because
Get
when
right
I first
into the website.
when I first was introduced, we were called by a nurse from the hospital who's not a nurse. It was a provider whose job it was to walk us through the prepping for this.
Sure. Okay.
And that worked out just terrific. In that case, we had to download an app. And I don't think you need to download an app on yours, which is really...
It's through the website. And I think if our viewers look right now, your website is up.
Right. So we have the tomahealth.org website up, and then there's an icon for Toma Video Visit.
Okay.
And in the Toma Video Visit, the webpage describes so much of what we're able to do. If you can go back up to the top of the visit, it talks about what we can see, what it involves. If you scroll down the page a little bit more, it even sees examples of things that we can see.
Sure,
so
like
people
you
are
said,
asking,
a
like, what are we
rash.
looking at? And one of the things that we've noticed with nationally, emergency room visits and urgent care visits have gone down a lot across the nation. People are afraid to come in. They're afraid they're going to get corona. They don't want to be exposed, and they're trying to figure out how they can be seen. And they could have come in something simple for a bladder infection. They could have talked to somebody on a video visit, but they're waiting, and now they're getting like a serious kidney infection and getting in the hospital. So we're trying to help people, you know, nip things in the bud and still come and be seen, but you're just going to be seen virtually.
So you've got like the prevention, intervention, and now we're at the serious stage.
Right.
So
And
you
we
really want to
wanna-
get to the prevent,
and treat it in the beginning. Exactly.
And
Excellent point.
I'm sorry. So these type of visits that you can see on there, and for the viewers may not be able to see this on the website, but things like sore throat, colds, upper respiratory infections, pink eye, bladder infections, rash.
That leads me into my question about medication. So is a doctor able then maybe to prescribe a medication?
Absolutely.
So if you feel like you have a really like an infection and you need an
Antibiotic. Yes.
As an antibacterial.
When we're doing this, even though this is the platform that we're using for the video, we're actually on our Epic computer, our electronic medical record. So we're documenting the visit in that record, and through that record, we are able to electronically prescribe medications. So we will send it to your pharmacy of choice. We'll confirm which one you use. It just gets sent to them, and you're able to go and pick it up.
Right. And the provider then could do referrals too. Right?
If we need to. And then we can tell people, you know something, this is more serious, you actually need to come in.
Oh, okay.
And sometimes it may turn into that. The virtual visit, which somebody thought was something benign, may be something more serious that we need to encourage them to come into the emergency room for.
It's a good connection.
Gonna follow up.
A minute left. Is there a cost to the video visit?
It's $55, which is a very reasonable cost.
Oh,
When we look
yes.
at the cost of what we're emergency rooms and healthcare and urgent care visits are, it's very reasonable.
It's almost what you gals pay for a perm or something, isn't it? There's
A little
I
less.
don't know we do perms anymore.
perms,
man.
whatever. Come on.
I think nails.
Yeah.
Well, that's great, huh?
That is excellent. And is it up and it's up and running now?
Yes, it's up and running, and it works Monday through Friday from 9 to 5:30. We're also using it in palliative care and hospice. The specialty clinic is using this now as well. And then we're going to start with our OB department doing lactation consultants for moms who are having problems with breastfeeding.
Wow.
Excellent. Thank you so
Yes,
much for
you're
coming
welcome.
in.
Thank you, Becky.
Excellent.
That's
You
really
betcha.
good information.
Okay.
Excellent.